Botswana's Multi-Sectoral Framework for the Prevention and Control of NCDs by Benson Law, Joya Kun, Juliette Young, Leanne Nolte, Linda De Silva, and Matthew Magyar. The Republic of Botswana is an African country, once one of the poorest in the world, that has since become an upper-middle-income economy. Botswana suffers from a high prevalence of chronic and non-communicable diseases. NCDs accounted for approximately 31% of all mortality in 2008. This country has listed 4 major chronic diseases that account for 82% of NCD-related deaths, along with the 4 most common risk factors addressed in this slide. Please take a moment now to read through the learning objectives. We will begin by introducing the objectives of Botswana's NCD plan. Botswana hopes to increase NCD screening and diagnostic capacity. Next, they would like to increase individual, family, and community awareness of lifestyle factors contributing to NCDs. Thirdly, they hope to standardize NCD treatment and drug prescription guidelines, and finally, increase technological capacity and patient record keeping. We will explore these objectives later on, but first, Botswana's framework for chronic diseases.
This is the Republic of Botswana's framework to monitor, prevent, treat, and manage NCDs, or non-communicable diseases. As you can see, it's very much a top-down approach, with the government on top and individuals, communities, and families at the very bottom. It begins with the Ministry of Presidential Affairs, Governance, and Public Administration. Generally, this ministry develops the government strategy and plans public projects and programs. For NCDs specifically, they determine, number 1, what NCD to tackle, and number 2, what interventions to implement, for example, vaccinations or screenings, and 3, how much funding is allocated for that specific effort. This overarching mission, developed by the Ministry of Presidential Affairs, is then implemented by the Ministry of Health and Wellness. They are the ones that coordinate the resources on the ground to make sure that the programs and policies are working. They are assisted by the National Statistics Office, which is the gray box on the left, and they provide feedback to both the Ministry of Health and Wellness and the Ministry of Presidential Affairs with up-to-date information. You can think of it as similar to the function of Statistics Canada. The other gray boxes represent state or influential sectors the Republic of Botswana relies on in their effort to treat, manage, and prevent NCDs. Of particular interest are the parastatals, which are semi-state organizations that exert political influence and serve the state independently through their own predetermined function. These can include, for example, the Bank of Botswana, Botswana Housing Corporation, and the Botswana Power Corporation, just to name a few. They act as supporting roles that can help the Ministry of Health and Wellness coordinate their NCD interventions as well as provide critical resources. The green boxes represent the more local organizations and district bodies. Of particular interest is the DMSAC, the District Multi-Sectoral AIDS Committee. Although not directly related to NCDs, they are an important part of the strategy because they represent pre-existing healthcare resources that can be redirected from the AIDS/HIV epidemic to NCD interventions. However, there have been critics to the DMSAC, stating that they act as extra bureaucracy and red tape in a state that's relatively small. Also, please pay attention to the VDCs, the Village Development Committees. They represent ordinary people in villages that help to monitor the implementation of NCD interventions. This represents a unique part of Botswana, as like many parts of Africa, villages are still commonplace outside of major metropolitan cities. Finally, I want to bring your attention to another unique aspect of Botswana's NCD framework, Kigatlas, local community village councils that are often led by elders. They act as governments and courts on the local level. I pointed this out because they play an important part of the country's NCD framework, as buy-in from Kigatlas are a critical factor in the successful implementation of NCD programs. Without their buy-in, uptake of strategies and programs developed by the very top by the Ministry of Presidential Affairs are not likely to be successful. Now that we have a description of the basic framework, we want to dive deeper into 3 critical parts of the strategy that is yet to be highlighted in this framework diagram. Those 3 things are number 1, policies, number 2, community involvement, and number 3, provider and patient capacity.
Botswana's strategic plan for prevention and control of NCDs between 2018 and 2023 includes policies that require multi-sectoral engagement and decentralization in some areas. The 4 major issues giving rise to NCDs in Botswana are tobacco, alcohol, unhealthy diet, and environmental exposures. As such, majority of the legislative, fiscal, organizational, and health sector policies serve to place regulations, subsidies, or taxes in these areas. The framework includes plans to increase the 30% tobacco levy formally implemented through the 1992 Control of Smoking Act. This act is currently under revision, and the levy sits at 55% and continues to increase yearly. Additional policy plans include those to fully implement the FCTC, creating bylaws that ensure completely smoke-free environments and bans on advertising, promotion, and sponsorship. Policymakers recognize the need to decentralize tobacco services to local authorities, such as the police and NGOs. The Control of Smoking Act is also under revision to activate NGOs providing education, communication, and awareness of health risks associated with tobacco. Some of these NGOs include the Stop Smoking Support Group and the Cancer Association of Botswana. Implementing these policies will require the cooperation of the Attorney General Chambers, the MOHW, and the Ministry of Local Government and Rural Development. Policies in place regarding alcohol consumption include the 2008 Levy on Alcoholic Beverages, the National Alcohol Policy for Botswana in 2010, and the 2013 Road Traffic Limit of Alcohol Regulations. The framework includes goals to revise these policies, addressing issues of producing, distributing, marketing, consumption, and reducing the alcohol limit for drunk driving offenses, respectively. Additionally, in 2010, management of Botswana's alcohol levy moved from the Ministry of Trade and Industry to the MOHW, which indicates the government's recognition of the need to decentralize this service. Botswana plans to integrate regulations to promote a healthy diet through taxations, fiscal incentives, or subsidies on imports of unhealthy foods. Additional plans exist to promote access of healthy food at school and develop policies that promote physical activity. These policies require the engagement of multiple ministries summarized on slide 11. The framework also calls for a number of policies appropriate for management and disposal of waste, which require sectors including the Ministry of Land Management, Water, and Civil Society.
The Ministry of Health is working closely with stakeholders to formulate a multi-sectoral approach involving NGOs, community-based organizations, and local community leadership to promote NCD prevention. In addition, Botswana has developed a guideline for stakeholders. Although not legislated, it provides suggestions and a direction for the public to follow. The goals highlighted in the guidelines include that, by 2022, all stakeholders must 1. Ensure staff awareness on NCD risk factors and services available. 2. Embark upon intensive campaigns to link staff to screening services for obesity, hypertension, diabetes, and cervical cancer. 3. Setting up of mechanisms for reporting NCD-related activities. 4. Including NCD programs, projects, or activities in annual action plan. 5. Establishing a sector budget line for NCD-related programming. Within Botswana, there is limited community-based interventions and also a lack of funding. The Ministry of Health, however, has set a goal to strengthen the community's capacity to prevent NCDs. These goals include increasing awareness through radio, TV, and social media, improve local facilities, neonatal, maternal, and child welfare services, expanding their reach into the community through churches, school, traditional medicine clinics, and village health communities. For example, in school, they hope to promote healthy diets, physical activity, and vaccination programs. Together, MOHW hopes to promote supportive environments such as creating neighborhood football leagues within communities, with the goal of improving physical activity and reducing NCD prevalence. Within Botswana's population, it can be seen that many patients are uninformed. One example from Botswana's multi-sectoral strategy for prevention of NCDs suggests in 2016 and 2017, only 19% of all patients went for screening. Nonetheless, Botswana has recognized this as an area of concern and hopes that informed clientele can boost screening procedures to 80% by 2023. Botswana also hopes to target women, a traditionally overlooked demographic, by increasing breast cancer awareness. Another example is heart disease, which accounts for 18% of Botswana's mortality. However, 23% of patients were not aware of their hypertensive condition. Nonetheless, Botswana hopes to increase overall chronic heart disease awareness to 70% by 2023. Botswana also has a goal to expand care and support services for cessation of risky behaviors to further reduce the prevalence of NCDs. Moreover, under the Department of Primary Health Care, Botswana has had an established health education unit since 1974, with the goal of educating the organizations and communities. Additionally, to improve prepared teams, the MOHW hopes to improve diagnostic capacity in order to reduce wait times and more quickly treat NCDs. Botswana also wants to target high-risk groups such as those in the mining industry, from prevention of chronic obstructive respiratory diseases. Botswana will also be integrating NCD's training into regular provider curriculum to better prepare primary care providers and in order to better improve NCD prevention, treatment, and management.
Thank you for your attention during the first part of our presentation. We now invite you to continue on to our second part, an informational poster that presents a comparison of Botswana's plan to the Ontario CDPM, along with addressing criticisms and providing potential improvements.